Hi, this is Jamie Marbo with Inspired Hygiene. Today I am recording my video for you from a hospital in Utah where my family lives, and my dad just underwent a procedure where he had to have his pacemaker and defib device replaced. So everything went well. It's considered a low risk procedure, to be honest with you, and things went well, but when they were getting done, they couldn't get his bleeding to stop. That's when the doctors and the nurses were at a heightened alert on taking care of my father. They were paying attention to that bleeding, of course, and we would expect that, right? So now I wanted to move that and relate it to us in the dental field. Many times we minimize bleeding and we see, oh, you have a little bit of bleeding, you need to floss more, or you need to get a water pick. And that's great. We're trying to get that bleeding under control. But lots of times we minimize it in our language and we minimize it in our treatment recommendations. Why do we do that? We are taught to focus on our pocketing and those millimeters. And if they go from a 4 millimeter to a 5 millimeter, is it now time to do something different or whatever it is? But we really honestly lots of times minimize the bleeding. And I want to challenge your thought process on that. I want you to think about that bleeding and how none of our patients get bone loss unless they start with the bleeding first when it comes to periodontitis. So if gingivitis is the gatekeeper to periodontitis, why do we minimize it? Let me give you another analogy that might help you get over the minimizing of that. My dad, I'm going to go back to my dad and many of our patients. My dad first started out in his younger years with high cholesterol. His medical doctors and nurses talked to him about his diet. They talked to him about his exercise. And when his body didn't either respond or he wasn't compliant with those recommendations, they then had to put him on a medication, right? Same thing with his blood pressure. Diet, exercise, couldn't get his blood pressure under control. So, of course, he had to get on blood pressure medication. So, all of those steps and those things that his medical doctor was doing was to try to prevent him from having a heart attack, stroke, or worse, death. And that's what us taking bleeding more serious is also doing. When we think about it, yes, the patient can lose their teeth. We know that with severe neglect and things like that. But we now know so much about the oral and systemic link. We're not just talking about millimeters and losing teeth. We know that those pathogens that are sitting in the base of those pockets, running amok throughout their whole system, through their blood, that is causing havoc and that can increase the risk of our patients having heart attack, stroke. And it also influences their diabetes if they are diabetic, or it can help push them into being diabetic. So we need to take that bleeding, those first steps, and we need to look at it every single time they come in. Is there something different we need to do with our services or with what our patient is doing at home to help that patient be at less risk for, yes, losing a tooth and losing more bone, but more importantly, saving their life? Thank you and make it a great day. Take that bleeding serious and do not minimize it any longer.